Hi guys, so just wanted to show you really quick what a heparin order looks like for those of you that are not too familiar with it. So this is an actual order for a patient that is on heparin drip. So a few things to note about this order is, of course, it has the name of the medication, and it's to be infused 25,000 units, 250 mLs in D5W premix. And it was calculated that it will start at 16 mLs per hour. So depending on what hospital that you are in, it would already calculate the start rate for you, or it will have you calculate it yourself, okay? But just so you guys know, one of the main factor in calculating the weight, not calculating the weight, but calculating the mLs per hour for the start rate of your heparin is heavily based on the patient's weight. So as you can see here, this is pretty much standard for infusing heparin. So as you can see here, it says initial infusion 18 units per kilogram per hour. Well, this is the calculation that is used just to kind of determine exactly what we need to start the heparin drip on, okay, which I already said it's been calculated that it will start at 16 mLs per hour. Of course, anytime that you have a heparin order, you're always going to make sure that you have a reason for it. Of course, for this here, it says instruction DVT PE treatment protocol. And it also gives you certain instructions what you should not be exceeding based on what is safe that pharmacy puts in there as well. So another thing to note in this order here, because these are standing orders for the heparin, it tells us exactly how to titrate, okay? So that goes for many medications that you'll find in the ICU settings that are drips. Normally it will have standing orders on how to titrate, so that way you know exactly what you need to do, when to check certain levels. This person, for example, for this order, it says, you know, when you do the next APTT is what we use just to calculate, you know, how the patient's doing, if we need to like decrease the heparin or increase it. Some hospitals use anti-XA. For us, we use APTT in our hospital policy. So that kind of tells us exactly how to titrate the medication, okay? One thing to note is that usually with the first initial start of the heparin, the physician has to give you orders whether we should bolus or not, okay? So just because this is here, you're not going to immediately bolus the patient unless the physician gives you an order for the initial start of the heparin that you should bolus the patient, okay? But it does tell you how you need to titrate once the heparin has started. For example, if I do my first APTT after the heparin starts, and you know, if my level was, let's say, was 32, then it tells me the guideline what I need to do. So I'll be bolusing 40 units per kilogram, and then I'll be then increasing the rate by 100 mLs by 100 units per hour, and then I will be rechecking that APTT level in 6 hours, okay? So it kind of gives you a little bit of guideline how to increase and decrease the heparin dose and when we need to recheck the APTT levels, all right? Hi guys, so to look at that same patient again, just like I said, we already started the heparin drip. So now, you know, there's an order to, you know, based on our last APTT that we did on the patient. Like I said, it was 6 hours since the heparin started. We did an APTT was 32. So now it gives us instructions that we need to bolus the patient 40 units per kilogram. And then increase by 100 units per hour. So now this is what we're going to be using. Our hospital policy, well, our hospital system, it already has calculations for us that was done by pharmacy. So it kind of gives us some guidelines here, okay? There's two different options. It tells us here what to bolus the patient if we had to bolus based on 80 units per kilogram, based on what the APTT level was. And it also gives us 40 units per kilogram based on what, you know, the APTT was as well, okay? So for a quick recap, we agreed that, you know, based on our titration, we had to bolus at 40 units per kilogram and not the 80 because the APTT was 32. So we're going to be following this guideline here. So what we're going to be doing is we're going to be looking at the instructions in our orders that it says, based on what the levels were, we're going to be using that 40 units per kilogram order. So that means we're going to be bolusing that patient at 3.5 mLs per hour, which is 3,500 units. So this is how much of a bolus that we are going to be giving that patient, okay? And like I said, then we're going to be increasing our rate by 100 mLs per hour. Okay, so you always have we have these standing orders there, so you don't have to, like, really do a whole lot of math here because it's already been done for us. But I always encourage everyone, always double check the math. If you feel like maybe something is completely off, or maybe it's like not appropriate for your patient, definitely use common sense and make sure that we use appropriate levels for your patient. All right.